After a second confirmed measles case in the greater New Orleans area, a local hospital prepares for the chance more cases could pop up. But hospitals are running into an unusual problem. Many of their doctors and nurses have never seen measles before.
Tan Trong reports on how they're overcoming that issue.
For decades, measles was sort of a disease of the past.
The last case of measles that I saw in the United States was 1989. So it's been a long time since I saw a child with measles here in the U.S.
Dr. Mark Kline is the chief medical officer at Manning Family Children's Hospital in New Orleans. He and other physicians say with falling vaccination rates, measles is now spreading again, and that's concerning.
Vaccination rates have declined, and measles is sort of the canary in the coal mine.
It's very important that those of us that can get vaccinated do.
According to the CDC, cases of measles had dramatically declined by the early 1980s, and by 2000 it was declared that measles was eliminated in the U.S. But in this year alone, there have been hundreds of cases reported across the country, including 2 adult cases here in Louisiana. And because there's been such a gap between the last time measles was a medical issue in the country, both Children's Hospital and Ochsner Health System are now training their staff to better identify the highly contagious and potentially deadly disease.
Most of our healthcare providers are too young to have ever personally seen a case of measles.
Most of our providers were trained in eras when measles had been largely eradicated in the United States.
Dr. Catherine Baumgarten is the medical director for infection prevention at Ochsner Health. She says some of the training includes being able to spot the symptoms and signs.
We also send out pictures of what measles looks like, because a picture sometimes is worth 1,000 words, right? You know, if you see that picture and you have that picture in your brain, then when you see a patient that may be similar to that, you think more about, oh, maybe I need to consider measles.
Measles is a disease that produces a very characteristic rash, a severe rash, high fever, cough, cold symptoms, and conjunctivitis, where the whites of the eyes turn red. And so it's all of those things taken together.
The goal, of course, is to limit the spread.
So far, Louisiana has been spared any pediatric cases, but it's really just a matter of time.
I would not be surprised if we see more cases.
But the doctors say now is the time to get their people prepared. In New Orleans, Tan Trong, Fox 8 Local First.